Welcome everyone back to another episode of Q&A with Sharon's son George. I was my mother's caregiver after she was diagnosed with Parkinson's disease. Unfortunately, she passed on 1/1/2020, but we started together for Sharon.com in her memory. We've had some incredible guests, but today is somebody not just incredible, but also so educated in some of the areas I'm not just honored, but really privileged to have him because I can't talk about. Plus, I always say I'm might be a doctor, mine's a PhD. I'm not a medical doctor. I only play one on TV, but he is actually both plays it on TV and is in reality an MD. And I'm really, again, just honored to have you, doctor, on our show. So welcome to the Q&A with Sharon's son, George.
Thank you so much, George. It's a privilege to be here.
Thanks. Well, I really wanted to get to this because there's so many important topics, and there are so many people listening right now who have so many questions. So maybe you could tell us just a little bit about your background, and then really, again, excited and honored to have you here.
Sure. I'll get up front that I'm not a neurologist. I'm certainly not a Parkinson's expert by training. I'm a cardiologist by training. I spent about a dozen years in academic medicine. Towards the tail end of that, I started working as an advisor to the FDA on advisory panels in the drug center, and eventually was recruited in and served in a senior position at the FDA. And when I was there, just to be real clear, I wasn't functioning really as a cardiologist. My portfolio of projects was much more broad than that, which gave me a chance to learn from different disciplines and gain more insights. And I'll tell you, maybe the most amazing thing was getting a sense of what the people are like at the FDA who work there when they're not worried about saying something they shouldn't say in public. An incredible place. The science, the focus on public health, the commitment really was just fantastic. So that's the background. After leaving the FDA, I've spent almost 10 years working as a consultant to different companies, developing drugs or developing devices, whether it be regulatory matters with the FDA or how to run a clinical trial, sort of covering a whole range of things. And again, providing me with a broad base with which to look at things rather than the way I was as a cardiologist, where I was really focused on this narrow area, in that case, heart failure transplant. Just like most movement disorders, they're not really general neurologists. They're focused really on the movement disorders and some solely Parkinson's.
I appreciate it. And I'm so, again, I don't want to say blown away, but I said it about your experience and background. I do have a question. Is there anything that affected your life, maybe personally, that brought you into the world of Parkinson's? Obviously, I went from the world of policing and law enforcement as an advocate to the world of caregiving due to the struggle my mother had with Parkinson. But just curious, and the viewers might be also, was there something kind of that touched, your life out of the medical field, or maybe even a patient that brought you to the world of Parkinson's awareness?
Well, we're all aware of Parkinson's to an extent because it's a prevalent condition. It's common enough that everybody knows at least somebody with Parkinson's or somebody touched by Parkinson's. But for me, the real key thing was my buddy Ivan. So Ivan, one of the people most dear to me, most inspiring, an incredible person who had Parkinson's and was starting to feel the effects as things started to get worse. He was starting to dwindle. And, I was watching that happen, and it was Ivan saying to me, "Hey, you're a smart guy. Why don't you do something to help with Parkinson's? You could do this." And I did not have the optimism in my skills the way he did. But he was kind of as wonderful he was relentless, which I think was one thing we certainly had in common. And really to get him to be just to sort of take a step back, I said, fine, I'll start reading about Parkinson's. And in doing that, I started to come to some realizations about gaps in knowledge, contradictions in approaches. And that just fueled my curiosity, because then I started to think, well, maybe I can figure out something to do. And at that point, it was really very narrow. I was thinking, what can I do for my buddy Ivan? Maybe I can do something. Maybe I can actually do something. And that's how it started.
Well, we send our love to Ivan and everyone, of course, battling this disease. Really, he inspired you, but in turn, now I know Ivan, and also you inspire so many. So thank you for that. Maybe we could also now shift to the world of Parkinson's, the treatment. Maybe you could discuss a little bit about how you think we might be able to treat Parkinson's a little bit more effectively and efficiently. I don't know if you know my journey. We went to about 15 MDs, movement specialists, though. They continue to say you don't die of Parkinson's, you die with it. But my mother had no other medical issues. Obviously, you're not our medical doctor, so I don't want you to have to kind of be blamed. And I don't blame doctors or the medical industry. I blame the disease. It's no one else's fault. But she had it for about 15 years. And what shocked me is it accelerated after she went to a trial. That night changed her life. But the last 4 years is when I took over her life. And I never saw anything kind of move so quickly in my life. And I don't even think the medical doctors that we saw understood it. And then she passed at a young age of 69. In my selfish world at 2024, I feel like we should be living till 85, 90. And I'm just always curious. And the one thing that we do have to say, of course, always is every journey is different. So no one can judge, my mother's journey than someone else. So that's one thing is important. But maybe again, we could talk a little bit about, how maybe you think you could, not you personally, but anyone in the medical professional might be able to treat Parkinson's, whether what they're doing is right now or maybe in the future what we can change.
It's really the key question, because just watching a disease unfold that has the kind of impact on people, especially in the last chapters of their life, the way you were just describing with your mother is, I mean, of course it's horrible for that person, but it's horrible for everybody around them. And so I'll often say that, when I think about why I'm doing this, it's for the people with Parkinson's, for the million people in the US with Parkinson's, million plus, and it's for the what? 3, 4, 5 million people who are feeling powerless as they're with the person with Parkinson's. So, this is a big problem. And for anyone to say they know exactly what the answer is, since we don't have any answer proved, is just not right. So I'm not going to tell you that I know how to treat it. What I will tell you is for something I do know. What I do know is the way that we're taught Parkinson's manifests its root cause, so-called, as we say in medicine, the model of disease. I know that the current model of disease is wrong. Now, there are very few times you'll hear me say, I know something, I'm absolute. I may sound very confident, but there's a difference between confidence and knowing. And I can say that we know the model is wrong for, a very simple explanation would be this. I remember when I went with Ivan to a doctor's appointment, and I mean, there's actually a doctor's phone call. We weren't even going into the office just to ask some questions. And I said, I have a question. I'm a cardiologist. This is going to be a little simple, but I'm looking at all the textbooks. I'm remembering what I was taught in medical school, that Parkinson's is a disease of dopamine deficiency. Now, that's been the statement of the disease since the 1960s. If indeed that were true, then why is it that with all of these medicines that we know are potently, reliably increasing brain dopamine, are unable to fix the disease? So if you have a hypothesis for the problem being dopamine deficiency and you reverse dopamine deficiency, why do people keep getting worse? Because your original hypothesis is wrong. It's not a disease of dopamine deficiency. So I think the first thing that we need to do, when I say we, it's anybody who's interested in advancing this, is recognize that the way we've been treating Parkinson's disease since the 1960s is wrong. That's why it doesn't work. Everybody will tell you about, oh, I took such and such drug and it helped me for a while. Yeah, it helps you for a little while. That's called a palliative therapy that masks symptoms without addressing the underlying cause of disease, and that wears off after a while. What I can't say I know, but what I feel is very strongly supported by a lot of scientific data is this alternative. The alternative treatment, which fulfills the textbook definition of being contrarian. because it's completely opposite to the current standard of care, is that we should be giving medicines that reduce dopamine. That wasn't a misstatement. I believe that dopamine reducing therapies hold promise for conquering the disease. And I say that based on data. There are data, and we published this observation in 2021, the first one, which is that if you look at how much dopamine is inside the key brain cells called dopaminergic neurons, which up till 2021, nobody has done, you learn that the amount inside the cells is way higher in Parkinson's than in normal people's brains. And I hate to use that scientific term where you call somebody Parkinson's and somebody normal, but it is the scientific convention. So sorry, I don't want to sound insensitive, but that's sort of the convention. I'm trying to change how we treat the disease. I'm not going to fight the battle for what terminology we use. I'm just going to use a standard terminology. Having shown that the level of dopamine is high in the cells is so critically important, because that's what determines whether these cells can initiate and allow normal movement or not. So if there's not enough dopamine inside the cells, you can't move. If there's too much, that excess dopamine becomes toxic to those cells, so they stop working and eventually start to die. So too little, you can't move. Too much, you can't move. It's got to be just right. Now, I'm not saying that all the studies showing low dopamine levels are low are wrong. They just actually measured the wrong thing. So I live in the New York City area, in a neighborhood, in a region that probably, if you looked at it, has a lot of wealth. There's a lot of investment bankers going back and forth, a lot of professionals going back and forth. If you looked at the entire neighborhood, you would say, oh, there's plenty of wealth. Nobody needs any extra help, any extra services. Just like if you looked at the entire neighborhood of brain tissue, you could say, oh, there's not enough dopamine. We have to give more. But just like you need to know what's inside the cells, you need to know how each family, each household is doing. There are food deserts in my neighborhood within 5 minutes of communities that I certainly couldn't afford to live in. So it's not just about the neighborhood. That's not, I mean, in the 1960s, we didn't know better. But now we do. We know that there's a loss of cells, these brain cells. Before that, there's a loss of the axons, which are the ways that these cells communicate with each other. And there's even loss of some of the machinery inside the cells that are vital to managing dopamine and transmission and signaling and communication between neurons. So figuring out that there was too much dopamine, the next step was to say, well, what happens if you lower it? And I can talk about 9 different experimental models. Some of them are cell models. Some of them are animal models, generally small animals, not large animals, but animal studies and cell studies nonetheless. And each one of them shows that when you reduce the level of dopamine with this drug that we want to use in a clinical trial, pathology is reversed. 9 for 9. That's pretty strong. So I don't know it's going to work in people, but I do know that it's more likely to work in people than most other drugs that can't go 9 for 9. And we presented this, we filed with the FDA. The FDA appears ready to agree formally that we could go into a phase 2 study, and that now we're raising money so that we can conduct that study and prove or disprove what the data supports as my belief, that testing dopamine reduction therapy is the way to see if this is a way to conquer Parkinson's.
Thank you. And everyone out there listening, please support the doctor and his research. He's doing some incredible things, making great strides. I wanted to share your website, but while I do that, if you could talk maybe a little bit about I mean, you kind of just did a little bit more on the future of research in the field. You see, obviously, with that amazing biomarker recently, also the national plan just passed, thankfully. So maybe that'll help a little more federal funding, which I'm still kind of in shock that we've never had any legislature before, which is kind of heartbreaking. But maybe you could touch a little bit on the future of research.
Yeah, I think that there's certainly been a tremendous push towards advancing the field of Parkinson's. And while government funding has not increased as fast as anybody would want, there certainly has been a tremendous amount of fundraising and support through foundations. Michael J. Fox, the Parkinson's Foundation, and over in Europe, Cure Parkinson's, Parkinson's UK, and really, it's not fair of me just to cite those because there are Parkinson's focused foundations throughout the world. These foundations are doing a tremendous amount of research. I personally think, because I believe that this path makes the most sense scientifically, that they're overlooking this opportunity. That's why I'm out there talking to people, pitching, sharing the data, showing the plan. We recently received our first investment, so we're starting now to engage with manufacturers because the rate limiting step for us is going to be manufacturing the drug. So we want to start that first. So we're starting that now. Look, there are a lot of interesting things going on. I mean, you can debate which ones are the most promising, and everybody has their favorite horse, but I don't think you're going to find people that have data showing 9 for 9 for others other than this. And so I appreciate you showing. This is sort of my personal website. I'd really like people to go to either to basically go to my blog would probably be best, which is parkinsonsdisease.blog, where I have a weekly newsletter, and all the newsletters are up there. It's been I've been getting a lot of useful feedback, and in fact, our first investment came because of appearing on a webinar like this and doing the weekly newsletter to get the information out there. So please take a look, sign up, share it with people. I'm trying to walk the balance between informing folks about what I'm doing and then also showing people what I'm learning about Parkinson's disease, because you've got to be learning all the time or you're falling behind.
Thanks, and I'm glad. That's why the great thing is we do this kind of live, and everyone, you can go to parkinsonsdisease.blog and you'll see here I'm subscribing as we speak. So please join me in this fight for awareness. But the doctor is doing so many incredible things, and things that whether I have a lot of schooling, I can't really touch on. So I'm honored that we can again work side by side, not just now and tomorrow, but the future too. I wanted to also share, this is a lot more about your website. Of course, we'll stay more towards the other one, but if you do want to support the doctor, you can also look and you can see. The thing is funny is I have a PhD lawyer and several masters, and some of these articles are so comprehensive that I don't even understand, which is why I love that we can communicate, because this research is what changes the world. You're changing the world for the better, in my opinion. And it's just incredible. So everyone, again, please go to parkinsonsdisease.blog, subscribe. You can see literally live. I just did it. It took me less than a millisecond. So there's no reason, and it's free. I don't want to say much more about that. I'll leave it for the good doctor, but there's really no reason not to subscribe. Plus, you can also watch videos, which I love. YouTube, you can ask him questions and keep up to date with some of the most important aspects of this fight for awareness, hope for a cure. But I think supporting the doctor and all he does is very critical, because I'm hope someday maybe he even be part of the cure, and I'd be proud to say that's my friend. So thank you for all you do. And I wanted to now move to a last segment. This is the fun part, not that the other part wasn't fun, but that was the intelligence part and educational. Now I wanted to ask you a few questions, if you don't mind. You are allowed to, you have the right to remain silent, and you can just kidding, you don't need a lawyer. But can you list 3 words that describe who you are?
Well, I mean, especially as relates to what I'm doing here, I think is a reflection of who I am also, but it's about being curious, about being passionate, and I was going to say stubborn, but I think it sounds better if I say relentless.
I think you're honestly a pleasure. I mean, you've been so really responsive with us, and just, you don't know how much it means the world to me and so many listening. Can you share one moment or one most memorable moment that stands out through most of your work so far with awareness?
Yeah, I had a chance to through a friend to discuss the science with on two separate occasions with people who are giants in the field. One, a world famous neuroscientist, and the other who had led first the science and then the entire corporation of a large pharma company. And each of those was really geared towards me, through friends in each case, getting the introduction to sit down with either of them, who were they were a little scary because of who they were, like how smart, how accomplished, but getting a chance to present to them and realizing first that when I presented to the neuroscientist, even though there were questions that I didn't know the answer to, which he then followed up by sending me an email, several pages of questions that I had to respond to. He seemed to be actually very favorably inclined, thought I did a good job and said the science made sense. And then when I was talking to the scientist who became the head of one of the big pharma companies, and he said to me, I think I'd say your science is solid and your plan makes sense. And so it's really those two, I think, were really, really important moments for me to realize that even if I'm wrong in the end and this doesn't conquer Parkinson's, the underlying mission that those two events supercharged me to pursue is to make sure people realize we have to stand up and challenge an existing model of disease when that existing model of disease is not leading to any cures. So again, I might be wrong about this particular approach. I don't think I am, but I know I'm right that the current model is wrong, and we have to crack that model and be smart about creating a new one that gives us a chance to develop the therapies, to get the foundations on board who are also committed to the current model. And then I think there's a chance for either this or something else novel to be the big breakthrough that we need.
I appreciate it. This one's a little shift towards the caregiving world. And I like to bring individuals from behind the scenes out in your life. You don't have to use name, but who helps you during times of struggle? You're not doing work that's always kind of jump around, dance friendly, some tough topics and some tough uh, individuals fighting a tough disease like unfortunately my mother did. But if you could tell us who helps you during times of struggle, and also I was a caregiver, as you know, what tips could you give those listening who are caregivers?
Well, the second question is really tough because I don't think there's any right answer for how to be a good caregiver other than other than two things. I'd say you need to be a good person. It's always easier to care for somebody you love. And not to say that professionals who do it aren't doing it for the right reasons. And I saw a professional take care of my father-in-law when he was dying. He was a better caregiver than I could have been. So it's not just about having a loving relationship ahead of time. And I think the other is that I've seen multiple times when I was a practicing cardiologist is that the caregiver needs to figure out a way to do things for themselves every so often. Because if you don't recharge, you're going to break down and you're going to be no good to either you or the person you want to care for. So I think that's really important to remember. And then as for me, I'm just so lucky because of who I'm married to and what our three daughters are like. People telling you you're doing something wrong that in a loving way sometimes is the most powerful feedback you can get. And then when they tell you you're doing something right in a loving way, that's even better. So I'm lucky because of who my family is.
Well, again, we send our love to your family and everyone who supports you and your staff and everyone because without their support, I know what you do would be a little tougher. So thanks for that too. This one you kind of don't even have to speak, but I want you to, but you kind of already doing it by coming on our show, speaking to me and so many others. I know you've spoken to a few organizations that I support. We've donated a lot to from our family, but how do you think we can improve Parkinson's awareness globally?
There are people doing things way bigger than I can even imagine doing. For example, you talk about the recent legislation focusing on Parkinson's. I thought that was great, but I hate to sound negative, but I was kind of disappointed it didn't come with, $1 billion or a few hundred million at least. I have been, when I was working at the FDA, I have been on interagency working groups where the value of that is huge because it's impossible to know what another agency is doing. I mean, they function as silos. So having people together from different agencies, hopefully not too high up in the hierarchy, because when you're too high up, you don't know what's going on with the people doing the work. So somewhere in the middle, um, is a great way to make sure people know where opportunities might present to collaborate. When I was at the FDA, we had collaborations with CMS, the Center for Medicare and Medicaid Services, that were amazing in terms of how to look at devices as they were being developed. So they went through the development process more efficiently, worked with DARPA, worked with DoD in general, with the VA. You end up having incredible opportunities when you get two people willing to collaborate who can put their egos aside and look for ways to do good. And I'm hoping that's what comes out of that legislation. But again, like you, I would rather there was a number with a lot of zeros after it that came along with it.
I also think that passing it is nice, but not really enough, because now is where the work starts. Implementation, working in the public policy world and teaching is the most important critical thing. So everyone listening, again, I say every show, please reach out to your legislators and, don't harass them, but contact them several times in the day,
Yeah.
get them to move. Because this is just because I've heard a horror story where in one state, I don't recall, maybe California, they passed a registry to help with Parkinson's, and it's never done a thing for like decade now, or a few, it's just
Hmm.
sitting there. So thank you. This one I love. It's a new question we've added to the show. Who is your hero or inspiration?
Actually, the person who inspires me the most is my wife.
That's amazing.
She's
Mhm.
unbelievably creative, incredibly diligent, very caring, just always has amazing ideas and has open-mindedness and commitment to relationships that's really impressive. And not to mention the fact that she's an amazing artist.
No, that's beautiful. I'll send her a copy of this and she'll love it. As we kind of wrap up in a few, if you were asked to write a script to a movie about your life story, what would you call it?
I would try to avoid it. That's not the title. That
All
would be my
right.
goal. I would try to
I
avoid
thought
it.
that was a good name, so there goes mine.
That wasn't the name. That was the strategy.
And then the final question, and I wanted to also ask if you could tell everyone, how they can contact you. But if you could leave the Parkinson's community today with some words of encouragement, what would they be?
That there are people doing work that's different enough than what's been done since the 1960s that's going to get others to open their eyes, to start to be creative, to challenge the norms. And one group of us, one team, or maybe multiple teams, are going to come up with something that actually works to conquer the disease. I'm convinced of that.
I appreciate that. And, everyone, please go to rightbrainbio.com. I believe is that the best way to reach you if they had a
Yeah,
question?
there's a contact form. I read them all, but I just want to make sure people have the right expectations. I can't answer them all.
Also, he cannot give medical advice, everyone.
Yeah, well, that's clear.
I
Thank
get
you.
that a lot because I'm an attorney. I'm not able to give legal advice, but we can send love and support. And that actually leads me to my final word of the day or message I always tell everyone. And we love you. We support you. We care a lot about you, and you're never alone. I, along with the amazing doctor, will advocate for you. And I feel together our voices are just so much stronger. And I always say I'm just getting started. And that's because, only recently I learned about you, and I watched a lot of your work, and that's really, to be honest, on tougher days in my life and missing my mother. She was my best friend every day since she passed, and September is specifically tough. It's going to be, it would have been her birthday on the 20th of September. But seeing you and your work, and again, getting the opportunity to speak inspires me to go back and keep pushing and never give up until we have a cure at our doorstep. So I just wanted to, again, thank you for your time. Thank everyone listening. And, this is not the end. I do hope to share this 100 times if I can, because I do not think this is about a one time, 30 minutes. See ya. We have to keep sharing this. We have to support the amazing doctor. We have to share this because, once again, we don't want anything, in my opinion, I could be wrong, but a cure. And also, I think awareness together throughout the world is the key, and that's what we're trying to do, one guest at a time. So thank you, Doctor, again. I hope there's many more to come. Thank you, everyone, for listening. This has been another episode of Q&A with Sharon Sun. Please stay tuned because, like I always say, there's so much more to come, and I won't stop fighting by your side until we have a cure at our doorsteps. Thank you, Doctor, and thank you, everyone.
Thank you.